Yes.
Yes, start. Om Dhanvantare Namaha. A very good afternoon. I am Dr. Geeta Puttur. To become a successful practitioner, we have to be in continuous learning process uh, by attending CMEs, workshops, okay, to build our self confident, to do the clinical practice. Today we are having a very exciting and informative session, and I am happy to share that today we are conducting 40th webinar series. So we'll start the series with the Dhanvantari Stavana by Dr. Kanchana. Over
Thank
to
you,
you,
Shakuntala
Kanchana.
ma'am. Thank you, Dr. Geeta. Om Namami Dhanvantari Adidevam Surasurai Vandita Pada Padmam Loke Jararubhayam Mrityunashanam Dhataramisham Vividaushadinam Dhanvantari Ramanatam Sarvaroganivarakam Ayurveda Pravaktaram Vande Piyushadayakam Sarve Janaha Sukhino Bhavantu Om Shanti Shanti Shanti.
Thank you, Dr. Kanchana. Now I request our founder, Dr. Shakuntala ma'am, to welcome today's speaker and brief about our Ross group.
Thank you,
Welcome to you, ma'am.
thank you, Dr. Geeta. Om Shri Dhanvantare Namaha. Thank you so much, Sharad Pote sir, for sharing your knowledge. I welcome you on behalf of all Ross team. Thank you and welcome. And I welcome all the delegates in this webinar because this is very special today webinar. Sir is HOD of Cancer Institute at NIH Jaipur. And sir is sharing his knowledge since so many years. Sir is practicing, and it is very exciting because I'm since 1 year, more than I think 1 year, I am doing the follow up for webinars. Sir is that much busy. Thank you so much, sir, for your valuable time.
Okay, thank you.
And about Ross, everyone knows like Ross is Rudra Arbuda, Ayurveda approach one shelter, which is having the intention to bring all the Ayurvedic oncologists under one shelter to discuss, to enhance our knowledge and support each other. This is the main intention of Ross Group. Along with this, shortly I will say like we are doing every week 2 classes, one related to yoga class and another related to cancer, especially cancer classes, which is conducting Monday and Thursday. And awareness programs we are doing, screening camps we are doing, we are preparing our own medicines, and we are working on like we are going to oncologist. We do educational trips where we go and meet the oncologist, we discuss and we enhance our knowledge from this group. This all the work is going on in the Ross team. And by this short note, I welcome again once again all the delegates and Sharad Pote sir. Thank you so much joining this call. And over to Dr. Geeta.
Thank you, ma'am. Your dedication towards our team is very highly commendable. Thank you once again, ma'am. Now I request Dr. Amulya to introduce today's speaker. Dr. Amulya.
Dr. Amulya, behalf of Dr. Kanchana is doing. Please go ahead, Dr. Kanchana.
Thank you, Dr. Shakuntala ma'am. It gives me immense pleasure to introduce our eminent speaker for today, Dr. Sharad Pote ji. He is a professor and in charge for Ayurveda Cancer Center Consultation Unit at National Institute of Ayurveda, Jaipur, Ministry of Ayush. His area of specialization is Ayurvedic oncology and de-addiction. He has over 17 years of experience in teaching and clinical practice. He is the author of 4 books. His clinical practice and research is mainly focused on preventive and adjuvant Ayurvedic therapy for cancer. Near about 50 research papers have been published in national, international book review, index medical journal. Most of these are cancer and its Ayurvedic solution. He has also participated in various television programs like Hello Doctor, conducted by Patrika TV channel. Supervised for MD Ayurveda research scholar in the field of cancer and completed 7 clinical preclinical research work on cancer while 5 are in progress. He has organized 3 national conferences on cancer in 2018, 2019 and 2022, and he is an organized secretary, and he played important role to make the conference a huge success. He also played a major role for memorandum of understanding in between ACTREC, Tata Memorial Cancer Center, Mumbai, and NIA DU Jaipur. Chief investigator in clinical research on anti-cancer drugs V2S2, collaboration with ACTREC, Tata Memorial Cancer Center, Mumbai, which is financially funded by IML Pharma. At Indian Embassy, Den Haag, Netherlands, in the International Ayurveda Conference, oral research paper on Ayurvedic management of oral carcinoma. A case study was presented where financial grant was given by Ministry of Ayush Government of India. He has been awarded Ayurveda Seva Samman. He has also over 25 research citations. With such an expertise and specialization in Ayurvedic oncology, I am sure it will be a great knowledge enriching session by Sir. Wish you all a very happy learning. Thank you so much.
Thank you, Dr. Kanchana. I request to avoid interruption. I request all Vaidyas to mute the gadgets before starting the session. Now, I welcome Dr. Sharad sir to start the session. Over to you, sir.
Thank you, ma'am. Thank you, Sakundala, ma'am. Good afternoon to all. Myself, Dr. Sharad Porte, Professor in charge Ayurveda Cancer Consultation Unit, National Institute of Ayurveda, Jaipur. Today, we are going to discuss scope and challenges of Ayurveda in oncology. Friends, this is our cancer consultations and treatment unit, which is running in National Institute of Ayurveda since years. This is the facilities provided by our hospitals for cancer patients in our hospital. We conducted the first national conference in 2018, second national conference on 2019, third national conference on cancer on 2022, and latest we also conducted national workshop on cancers of GIT to establish the clinical Ayurvedic protocol for diagnosis and management of cancers of GIT, in which the eminent speakers and eye oncologists we invited, and their opinion and additions and suggestions incorporated in to establish the clinical Ayurvedic protocol for diagnosis and management of cancers of GIT. Friends, all of you know that the abnormal uncontrolled growth of cells is called cancers, and these are the 6 hallmark of cancers. One is the oncogenes, second is the tumor suppression genes, third is the tissue invasion and metastasis, fourth is the limitless replicative potential, fifth is the sustained angiogenesis, and sixth is the avoiding apoptosis. Now, oncogenes, in its normal unmuted state, oncogenes are called proto-oncogenes, and it's play major role to regulations of cell divisions. When oncogenes is mutate, it contributes the development of cancers. Increased activity of higher expression of gene product oncogenes proceed the abnormal and uncontrolled growth of cells. Likewise, the tumor suppression genes have also major role to keeping the check and balance of the cell divisions. You can say that oncogenes is the accelerator of the cancers, and tumor suppression genes is the break up break of the cancers. Oncogenes accelerate the process of the cell divisions, while tumor expression genes check it and try to stop the excessive growth of the cells. When the oncogenes and tumor suppression genes lost their check and balance, then it causes the cancers. Third is the apoptosis. Each and every cell have the programmed cell death, which is called apoptosis, and cancer cell lost the apoptic control and allow the cancer cells to survive longer and causes the accumulation of cancerous cells and formation of tumor. By limitless replicative potential and escaping immunosurveillance, cancer cell become the immortal. Sustained angiogenesis plays a major role to growth of cancer because every tumors or cancer cells need the food by blood supply. The tumor can actually get this blood supply by forming the chemical signals and forming the angiogenesis for the growth. Invasion and metastasis. Metastasis means spread of cancers, all of you know, and it happens by invading the vasculature, extravasations at distance organ, and colonization of distance organs. It causes the metastasis. Friends, all of you know that the carcinoma originated from the epithelial cells, all the epithelial cells, whether it may be glandular epithelial cell or non-glandular cells, while the sarcoma originated from all the muscle, connective tissues and muscles, while the glioma originated from nervous cells or nerve tissues, and leukemia, lymphoma, and myeloma originated from blood forming tissues or cells. Here, carcinoma originated from the epithelial layer of cells. The carcinoma form on the internal lining of the organ within the body. You can see here the epithelial cells. This is the layer of skin or mucosa. You can see here the epithelial cells, and carcinoma form or originated in these epithelial cells, whether it from the glandular cell or non-glandular cell. This is the epithelial cells where the carcinoma originated. It is very superficial cells of mucosa, or we can say the lining of mucosa. And while sarcoma originated in the connective tissues and supportive tissues, likewise the muscle cell, adipose tissues, bone, cartilage, fibrous tissues, all. And the polycythemia vera and myeloma and leukemia originated from blood cells, while lymphoma originated from the lymphatic systems or lymphatic cells. High-grade glioma, glioblastoma, astrocytoma, and astroblastoma originated from neuron or glial cells. There are also some mixed carcinoma, likewise carcinosarcoma. Carcinosarcoma means mixed pattern, somewhat carcinoma and somewhat sarcoma are together form the carcinosarcoma. While adenosquamous carcinoma, here adenocarcinoma of epithelial cell and squamous carcinoma of epithelial cell join together to form adenosquamous carcinoma. Now there are several types of carcinomas like squamous cell carcinoma, adenocarcinoma, basal cell carcinoma, transitional cell carcinoma, renal cell carcinoma, ductal cell carcinoma, invasive ductal cell carcinoma. Now, again, the carcinoma can be classified in various type of carcinoma. Likewise, squamous cell carcinoma of skin, tongue, palate, larynx, lung, and esophagus. The site of carcinoma is when it is skin. It will be called as the squamous cell carcinoma of skin. Means the origin will be, if the origin will be the squamous and site is the tongue, then it is called squamous cell carcinoma of tongue. If the site is the esophagus and the tissue is the squamous, then it will be called as a squamous cell carcinoma of esophagus. Likewise, that the glandular carcinoma, which is called as the adenocarcinoma of esophagus, adenocarcinoma of stomach, adenocarcinoma of small intestine, adenocarcinoma of colon, adenocarcinoma of rectum, adenocarcinoma means adenocarcinoma of liver is called hepatocellular carcinoma of liver, adenocarcinoma of pancreas also. Even adenocarcinoma of gallbladder, adenocarcinoma of kidney is called renal cell carcinoma, adenocarcinoma of lung, adenocarcinoma of breast, adenocarcinoma of ovary, adenocarcinoma of uterus. You can see here, when the site is lung and the tissues belong from the epithelial glandular cell, it is called adenocarcinoma. If the site is lung, but the tissues involved is the epithelial squamous cell, then it is called squamous cell carcinoma of lung. Both have different. Even sarcoma are various types. Likewise, liposarcoma originated from adipose tissues, myosarcoma originated from muscles, osteosarcoma originated from bone, fibrosarcoma originated from fibrous tissues. The multiple myeloma and leukemia and lymphoma, it is originated from blood cells. Even high-grade glioma, glioblastoma, glioblastoma multiforme, astrocytoma, astroblastoma, and medulloblastoma, ependymoma, oligodendroglioma, malignant meningioma, malignant cyanoma, malignant neurolemoma, and malignant neurofibrosarcoma. All these belong into the cancer of the nerve cells. Now, what is the correlations of the cancers, various cancers, and Ayurveda? How we can correlate? Friends, one thing I want to share that no one cancer exactly similar to the Ayurvedic term, but some clinical manifestation on the basis of the similarity in the clinical manifestation, we can correlate lymphoma as arbud, leukemia as a sanipatas pandu and maja dhatu ka jwar, skin as a rakta arbud, myosarcoma is a masa arbud, liposarcoma is a medo arbud, adenocarcinoma of GIT can be correlated with all type of the gulma, and carcinoma of ovary and uterus can be correlated raktas gulma, squamous cell carcinoma can be correlated dushta vran, hepatocellular carcinoma can be correlated to yakrutodar, carcinoma breast can be correlated with the drushtastan arbud or drushtastan granthi. Now, friends, all of you know that what is the definition of swastha? Definition of swastha is the samadosha, samadhatu, samagnicha, malad, samadhatu, samadosha, samadhatu, samagni, samadhatu, malakriya, prasanna atma indriya, स्वस्थ इति विधीयते. तो जब तक धातु और दोष और अग्नि और यश और मल इनकी विकृति नहीं होगी, तब तक कोई व्याधि नहीं होगी. तो ऑन द बेसिस ऑफ दैट, द विकृति ऑफ दोष एंड विकृति ऑफ धातु, we can correlate the cancers with various dhatu pradoshas vikars. Like if you will observe the clinical manifestation of lymphoma, then you can say that lymphoma may have the rasa dhatu vikruti having the kapha pradhan tridosh vikruti. The leukemia have also rasa dhatu prasodas, but pitta pradhan tridoshaj vyadhi. Even squamous cell carcinoma have a rakta dhatu vikruti belonging to epithelial cells, but pitta pradhan tridoshaj, while adenocarcinoma also originated from rakta dhatu, but we have the kapha pradhan tridoshaj vikruti. We can also classify the rakta dhatu pradoshaj cancers on the basis of clinical. Hello. On the basis of their clinical manifestations and the appearance, the squamous cell carcinoma of tongue, palate, buccal mucosa, and skin, we can place it pitta pradhan tridoshaj, while adenocarcinoma of gallbladder, pancreas, liver, stomach, intestine, ovary, and uterus can be placed pitanubandhi tridoshaj, having the kapha pradhan natures because it is having the granular epithelium involvement, and adenocarcinoma of breast, prostate, and lung can be placed kapha pradhan tridoshaj, while cancer of neuroendocrine tissues, cancer of neuroendocrinal, likewise cancer of neuroendocrinal tissues of the intestines, lungs, pancreas, and adrenal, we can place it vatanubandhi tridoshaj. Tridoshaj. If we saw the clinical manifestation of myosarcoma, it can be placed in dhatu pradoshas, means masa pradoshaj vyadhi, having the kapha pradhan in natures, having the kapha pradhan but tridoshas in natures. Liposarcoma have the dhatu meda dhatu pradoshas, having also kapha pradhan in natures. Osteosarcoma vata pradhan in natures, and dhatu may be asti. And multiple myeloma vata pradhan and dhatu pradoshas belonging to majja dhatu. Fibrosarcoma and chondrosarcoma vata pradhan having the snayu kandara pradoshaj vikar. Now all these was basics. Now question is that if there is any need of Ayurveda in oncology, what is the need of Ayurveda in oncology? Friends, cancer is a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020. Cancer also increasing day by day in India. It increased 13.9 lakh in 2022 along with death rate. Means in spite of the conventional therapy, including surgery, radiotherapy, cytotoxic chemotherapy, hormonal therapy, targeted therapy, immunotherapy, the cancers and death due to cancers has been increasing day by day. So there is need of Ayurveda in the oncology. So there is need of intervention of Ayurveda in the oncology. Now, what is the scope of Ayurveda in the prevention and management of cancers? We can categorize the scope of Ayurveda in two categories. One is the treatment of cancers of cancerous patient, and third is the treatment of chemoradiatoxicity of cancer patients. Treatment of cancer patients with objectives. What will be the objectives of treatment of cancer patients? First objective, to prevent the recurrence of metastasis of cancers, standalone or along with the along with the conventional therapy. To control the growth of cancers, standalone or along with the conventional therapies. Management of the palliative care, standalone or along with the conventional therapies. Second scope is the treatment of Ayurveda. Ayurvedic treatments for the chemotherapy and radiotherapy induced toxicity. And what is the aims? The aim of Ayurvedic treatment for the chemoradiotoxicity is to prevent the toxic effect before chemotherapy and radiotherapy, to control the toxic effect during the chemotherapy and radiotherapy, to prevent or to counteract the toxic effect after chemotherapy and radiotherapy. Now, we discuss first treatment of radiotherapy and chemotherapy induced toxicity. See, all of you know that nausea, vomiting, stomatitis, ulcerations, diarrhea, febrile neutropenia, hair loss, fatigueness, allergic reaction, anaphylaxis, peripheral neuropathy, sensory neuropathy. These are the common chemotherapy induced toxicity. You can see here the ulceration or stomatitis of the mouth due to the chemotoxicity. This is the peripheral neuropathy induced by paclitaxel. Peripheral neuropathy यहाँ पे आपको दिख रही है. This is the post radiation colitis. These are the lot of patients of cervical cancers after radiotherapy having the colitis. Now, how we can understood the chemotherapy induced clinical manifestation or toxicity as per our Ayurveda. See, chemotherapy, you can see here the reference for chemotherapy induced vomiting, not directly, but Tikshna Aushad. This is the reference of Sardi Chikitsa, Tikshna Aushad. And you know that all the chemotherapeutic agents or radiotherapy also, you have the Tikshna Aushad, or having more potent and causes the mucosal tear. One of the property of the Tikshna Aushad. One of the property of the Tikshna Aushad, and it is mentioned in the Kalpastan, Susrut Kalpastan Adhyay 2. The properties of Tikshna Vish. What is the karma? What is the karma or properties of Tikshna Aushad or Tikshna drugs or Tikshna Vish in our human body? The Tikshna Aushad may cause the vomiting. So we can correlate the Tikshna Aushad as a chemotherapeutic agents responsible for chemotherapy induced vomiting. Second, chemotherapy induced hair fall. Here you can see the Kshar, Oshna, Tekshnam drugs. You have the Khalitya. So you can say that the Kshar, Oshna, Tekshna drugs belonging to chemotherapy causes the Khalitya or hair fall. You can see here Lavan, Katu, Kshar, Oshna, Tekshna drugs causes the Pitta Jati SARS. Means the we can correlate it chemotherapy induced diarrhea. We can correlate the chemotherapy induced gastritis. Shara Ati Tikshna Aushad Vidahi Aushad causes the Pitta Prakop and then abdomen pain. We can correlate the chemotherapy induced febrile neutropenia. Here the Jwar Nidan, you can say here Ushna, Lavan, Kshar, Katuk, even Tikshna and Vish and also Tapagni. It causes the myelosuppression, may causes the Jwar or fevers. We can correlate here the chemotherapy-induced anemia in as per the Pandu Rog Chikitsa, Kshar Amla Lavan Ushna Tikshna drug causes the Pandu. Likewise, thrombocytopenia, chemotherapy-induced thrombocytopenia, we have a reference of Rakta Pitta Nidan, Tikshna Ushna Kshar Lavan, and Katu Aushad, which may causes the thrombocytopenia. And all these the properties, Ushna and Tikshna, these are the properties of again Vish also, and the karma it have the opposite karma of the Oj guna. You can see these karma of Ushna or Tikshna gun in Kalpastan, Susrut Kalpastan, Adhyay 2. Now, what may be the Ayurvedic management of chemotherapy induced toxicity? We have Padma, we have Lata growth, but I am giving the example here, the Padma growth. We can also use because Padma growth is not available in market. Instead of Padma growth, you can also use the Jivantyati growth or another growth having the Vishagna property. Vishagna property in the form of the oral injection, or also you can give it by rectal in the form of the Matra Basti. See, the ingredient of the Padma growth is the Padmak Swaras, Durva Swaras, Anantmul, and Bro growth. These Padma growth, the efficacy of Padmakati growth in counteracting the side reaction of chemotherapy and radiotherapy has already published by Sir Deshmukh sir from Pune, having the integrated cancer unit in Pune. You can see the Vishagna property of the Padmak ingredient of Padmak growth. Here the Daha Visha Pita Kapastit. It is the properties of Padmak. Even it is a Vishapan according to Dhanvantari Nigantu. Then Durva, you have the property Nila Durva Himatikta Madura. Again the property of the Vishaguna. Anantamul, here you can say it is also Vishapaha. Even Jor, Atisar, all these found in chemotherapy induced toxicity. And again it is Vishapaha along with the Jor, Atisar, and all these symptoms. It can pacify. Yeah, Anantmul have potential to pacify all these symptoms along with the Vishapaha. Even it is Vishnashanam property. And all of you know that the property of the Go growth, it is the Sarva Vishanam. ये सर्व विष का हरण करने वाला है. So we can use the Padmakati growth. Even there are lot of growth are there. Jivantyati growth, Kalyana growth you can use to counteract the side effect of chemotherapy or radiotherapy induced toxicity. We have the NI proprietary Vishagna and Rakta Prasadak Yog, having the ingredient of Sariva, Manjishta, Kakma, Chioshira, and Bhume Amalki. We have found the better result during the chemotherapy or after chemotherapy with these drugs. Now, second is the scope of Ayurveda in the prevention and management of cancers. Now, there are three. We have three objectives for the Ayurvedic treatment of cancers. One is to prevent the recurrence of metastasis of cancer, and second is to control the growth of cancers, and third is the management of palliative care. All these objectives we discuss here with case studies or with the case reports. Now we first discuss the role of Ayurvedic medicine to prevent the recurrence and metastasis after conventional therapy. Now see, 55 years non-motensive, non-diabetic patients of the post-operative malignant epithelial neoplasma, left breast, post-modified radical mastectomy, left side, and patient had also received radiotherapy and chemotherapy, come in cancer consultation treatment unit in Jaipur with complaint of loss of appetite, anorexia, weight loss, weakness, and insomnia. Friends, this is the treatment summary of patient which suggests that patient have received chemotherapy and radiotherapy. Histopathology reports suggest malignant epithelial neoplasma. After conventional therapy, PET scan suggestive of mild hypermetabolic mediastinal nodes. You can see here. We given in our cancer consultation treatments Arbudar Quat, so then Swarna Vasanta Malti, Tapyadi Loho, and Vikrant Basma, along with the Amrut Bhallatak Aulya, Mahavish Garbatel for local Abhyanga, not all over body Abhyanga, local Abhyanga with Sek and Amra Haridra left, then Lavan Bhaskar Churna and Sarjik Shars with buttermilk, Sanjivani Vati, and Mustadi Apan Basti, and tablet Enacarcins, 2 tablet oral for 5 months. This is the prescriptions given to that patients. Then after 5 months, this is the CT scan. After 5 months of treatments, no obvious changes in pathology was found. Now, second role and second objective was that to control the cancerous growth. The role of Ayurveda to control the cancerous growth without conventional therapy. We understood the role of Ayurveda to control the cancerous growth without conventional therapy by this case reports. 70 years old patient of CA lung came in cancer clinic with difficulty in breathing, cough, chest pain, loss of appetite, weight loss since 2 years. Patient had allergic bronchitis also. CCT before thorax showed heterogeneous mass 43 into 41 into 40 mm, and FNAC shows the squamous cell carcinoma of lung. This is the treatment given to the patients. The treatments basically given the Amrut Bhalata Kavalya, Swarna Vasanta Malti, Hirak Basma, Abrak Basma, Sringa Basma. Then we added here the Pipli Siddha, Godugda. See here the after treatments, after 6 months, after I think 5 to 6 months, the of treatments, the mass was reduced 38, 39, 38, and this patient didn't taken the chemotherapy or radiotherapy for this, for the CA lungs. This you can see the graphical presentations of results. The Ayurvedic medicines played the role to control the cancerous growth. I am not claiming that the cancer vanished or cancer destroyed, but I am saying that the Ayurveda played major role to control the cancerous growth. Even the tumor had regraded slightly. Now, this is the second study, the second case to explain the role of Ayurveda to control the cancerous growth without conventional therapy. These patients also did not taken the conventional therapy because patient not willing to take the conventional therapy due to some reasons. 32 years old female patients of Hodgkin's lymphoma came in cancer clinic, NI Jaipur, with complaints of nodular swelling neck, ear pain, weight loss, and cough since 3 years. Patient is treated with Bhallatok Yoga against. This is the biopsy showing the Hodgkin's lymphoma. This is the nodular mass before CCT neck. You can see here the first nodule and second nodules. This is the nodular mass of after treatments. You can see here the nodular mass of Hodgkin's lymphoma reduced. You can see here the changes in first tumor in Hodgkin's lymphoma after treatments. The first tumors had inhibit the mass, the first tumor or mass of first tumor reduce somewhat, and while the second tumors regret than first tumors. Here you can see that the first tumors, second tumor, you have inhibited. He had inhibit. Inhibit. This is the case of this what I am presented here. You can see this case on Journal of Ayurveda in Integrative Medicine also. This is the PubMed journal. I publish it, standalone Ayurveda management of Hodgkin's lymphoma, a case report. Same I was presented here. Now, role of Ayurveda in palliative treatments of cancers. 70 years old male patients with history of third stage cholangiocarcinoma, mass measuring 21, 25, and 36 with metastasis in liver, came in Ayurveda cancer unit in Jaipur with complaints of pain in abdomen, right hypochondric region, flatulence, distension abdomen, loss of appetite, weight loss, itching all over body, dark yellow eyes, means icterus in sclera, yellowness of nails and body. Patient had history of chronic alcoholisms. This is the all these symptoms since 2 years. This is the patient's. Patient has treated Arbudar Quad, Growth, Loknath, Ras, Tapedi Loho, Vikrant Basmain, Yakrut Lya Ras, along with the Drakshavlya, Lavan Bhaskar, Sarjikshar, Yavakshar, Mulikshar, and Mahashankavati. But you can see here the bilirubin increase in spite of Ayurvedic treatment. I given all these treatments, but instead of decreased of the LFT, bilirubin direct indirect increased. So I saw the quotations from the Padurok Chikisa, Sanshodha Mrudubi Stiktei Kamletu Virichane, and give the Mrudu Virichan to the patients, Tivrutta 5 gram HS oral daily. You can see the beautiful result. The bilirubin was reached up to 25. Come down in first visit after Tivrutta, not after the treatments. I had given the Tivrutta along with Ayurvedic treatments. Ayurvedic treatments was along with the Tivrutta. At first, without Tivrutta, the bilirubin was increased in size, not decreased. But after adding the Tivrutta, bilirubin was decreased in first visit 19.6, then 17.1, then 15.4, then 14.9, again it came 13.1. Even direct bilirubin came down from 16.59 to 9.8, and indirect bilirubin came down from 9.24 to 3.3. uh, you can see here the graphical presentations. So these are the scope of Ayurveda. We discuss here the two type of scope. One is the Ayurvedic treatment of chemotherapy and radiotherapy induced before chemotherapy, during chemotherapy, and after chemotherapy to prevent the to prevent to counter and to prevent and counteract the side effect or toxic effect of chemotherapy and radiotherapy. This is the one part. And second part, management of the cancer patients with objectives. First objective was to prevent the recurrence, and second objective was to control the growth standalone or along with the conventional therapy, and third is the palliative management. Palliative management standalone or along with conventional therapy. Now, in spite of the great role, major role of Ayurveda in oncology, I will say that without Ayurveda, the oncology branch will not fulfill. But in spite of all this role and scope of Ayurveda in oncology, there are some challenges, and these challenges we have to know during the practice. First challenge is that no one disease mentioned in Ayurveda is similar to cancer as per similarity index. So again, as there is no one similar disease, similar disease, exactly similar disease to the cancers, we depends on the dosh dhatu and mal, dosh dhatu vikruti and sroto vikruti for the diagnosis and management of cancers. Then second challenge is that most of the Ayurvedic doctors compare to the cancers with Arbud, which is partially wrong. बहुत सारे जो आयुर्वेदिक फिजिशियन हैं या हमें भी पढ़ाया गया बीएमएस में कि कैंसर जो है अर्बुद है. इवन आप अगर समझो आयुष मिनिस्ट्री की वेबसाइट में या सीसीआरएस की वेबसाइट में भी देखोगे तो कैंसर को अर्बुद के साथ कोरिलेट किया गया. In these comparisons is partially wrong, as only few type of cancer like myosarcoma, liposarcoma have similarity with arbud. Most of the carcinoma, which is originated from squamous epithelial cells, have not similarity with arbud, and they so we cannot label as arbud on carcinoma. There is no uniformity in the diagnosis and management of cancer amongst Vaidyas throughout the India. There is no standard SOP for diagnosis and management of cancer in Ayurveda throughout India. We tried in our fourth workshop, national workshop on cancer, to establish the clinical protocol for diagnosis and management of GIT tract through Ayurveda. But it was very difficult. It was very difficult task for us because there was no uniformity in the diagnosis and management of cancers in all over India amongst Vaidya. Even there is no standard operative procedure for diagnosis and management of cancer in Ayurveda throughout India. This is one challenge because you know that in oncology, allopathy sites, there you have the uniformity of diagnosis, uniformity of the medicines. They have standard SOP. What we have to do in first stage, second stage, third stage, fourth stage, first chemo or first radio, first surgery or first chemo. They have the standard SOP, but we have no standard SOP. When we have to use, what we have to use, and where we have to use the medicine. Then there is no standard Ayurveda textbook for diagnosis and management of cancer throughout India. We tried to write down the protocol for the GIT tract through Ayurveda protocol for the diagnosis and management, but a tough task was there, as there was no standard uniformity in SOP, even no standard Ayurveda textbook for diagnosis and management of cancer throughout India. Even Ayurveda have lack of clinical data. If because one clinical case is not sufficient as a evidence. One clinical, I saw one case reports, or I published one case reports in PubMed General, but it is not sufficient. We need the lot of clinical data, and now there is the lack of clinical data, published data in Ayurveda for cancers. Medical legal problem may be occurred as there is the lack of scientific clinical evidences of anti-cancer Ayurvedic compounds. Because we have lack of scientific clinical evidences of anti-cancer, so-called anti-cancer Ayurvedic compounds, that may be enacarcine, or there are so many market preparation also there, from south to north and north to south, from west to east and east to west throughout the India. But that anti-cancer, the marketed drug have also not sufficient clinical evidences, data. So there may be medical legal problems, we may face under the Consumer Protection Act. Then most of the Ayurveda Vaidya have lack of knowledge about prognosis, and it is not good for practice in oncology with incomplete knowledge and may face medical legal problem. Because why I am saying that, मैं ये क्यों कह रहा हूँ, क्योंकि complete knowledge is essential. half knowledge से we cannot, मतलब हम जो है प्रॉब्लम में आ सकते हैं, खास करके प्रोग्नोसिस का नॉलेज होना. बिकॉज मैं ये कहता हूँ कि मेरे कई स्टूडेंट जो है बाहर जाकर प्रैक्टिस करने का ये करते हैं. देखिए, एक प्रोग्नोसिस अलग अलग स्टेज में, एक ही अगर समझो हम कैंसर पकड़ते हैं, मान लो कि अगर आप कैंसर, लंग कैंसर को गृहित लेते हो, या आप अगर समझो ब्रेस्ट कैंसर को अगर समझो ये करते हो, उसको ये करते हो, तो अगर समझो उसकी स्टेज अगर वेराइज है तो प्रोग्नोसिस भी वेराइज होगा. इवन अगर समझो टाइप ऑफ कैंसर अगर वेराइज है, इन सिचु कैंसर है तो उसका प्रोग्नोसिस अलग होगा. अगर इन्वेजिव होगा तो उनका प्रोग्नोसिस अलग होगा. ट्रिपल नेगेटिव का कैंसर, ट्रिपल नेगेटिव ब्रेस्ट कैंसर का प्रोग्नोसिस अलग होगा और बहुत फास्ट ग्रो होता है वो, रेदर देन अदर ब्रेस्ट कैंसर्स. इवन लोबुलर कैंसर का प्रोग्नोसिस ये अलग है. तो इवन लंग कैंसर की अगर समझो बात कहे तो लार्ज स्केल स्क्वेमस सेल कार्सिनोमा और स्मॉल सेल स्क्वेमस सेल कार्सिनोमा का प्रोग्नोसिस अलग अलग है. सम जो कुछ कैंसर्स जो है वो फास्ट ग्रो होते हैं. इवन अगर समझो हम ब्रेन ट्यूमर की बात कहेंगे, ग्लायोमा है, लो ग्रेड ग्लायोमा है, बहुत स्लो होता है. और ग्लायोब्लास्टोमा बहुत एक फास्ट ग्रो होता है, इवन उसको रिमूव के बाद भी फास्ट ग्रो होता है. और हम अगर समझो हमें विदाउट नॉलेज ऑफ प्रोग्नोसिस, without knowledge of prognosis, if we assure that, because on the basis of the glioma, low grade glioma, we assure the patients of glioblastoma by our Ayurveda management, then it will be problems and we may face the medical legal problem. अगर समझो हम अश्योर करते ग्लायोब्लास्टोमा के पेशेंट को कि नहीं ये तो ठीक हो जाएगा और ऐसा हो जाएगा वैसा हो जाएगा, तो इट मे बी प्रॉब्लम्स. तो मोस्ट ऑफ द, तो हमें जो है, मैं सारे आयुर्वेदिक वैद्यों की बात नहीं कर रहा हूँ, लेकिन जो जनरल प्रैक्टिस करते हैं, ऑन्कोलॉजी की प्रैक्टिस करते हैं, आई थिंक दैट दे हैव नॉलेज, या दे उनको नॉलेज होगा, बट जो जनरल प्रैक्टिस करते हैं आयुर्वेदा के लोग, वो भी बहुत बार कैंसर का पेशेंट है हैंडल करते हैं, और विदाउट कंप्लीट नॉलेज ऑफ प्रोग्नोसिस एंड कंप्लीट नॉलेज ऑफ ऑन्कोलॉजी अगर समझो वो हैंडल करते हैं, और उसके बाद अगर समझो कुछ उसका पेशेंट का और उसको अश्योर देते हैं और उसको कुछ हो जाता है आगे पीछे, तो practitioner may face medical problems. In spite of challenges, the cancer will be prevented. In spite of all these challenges, we have some positives. What is the positives? The cancer will be prevented by Nidan Parivarjan, Patyahar Vihar, and by removing the accumulated carcinogens and its metabolites by using the basic principle of management of Dushivish and Dushivishar drugs. Then toxic effect of chemotherapy and radiotherapy will be managed by using the basic principle of Vishchikisa and antitoxic drugs mentioned in Ayurveda. Third, Ayurveda will play the major role to prevent the recurrence and metastasis of cancer after conventional therapy. Fourth, the growth of cancer will be inhibited by using the cytotoxic drugs mentioned in Ayurveda with conventional therapy or even in standalone. Fifth, Ayurveda will play the major role in the palliative cancers. Thanks. Questions and problems are welcome.
Thank you, sir. Thank you, sir. It was very clean and easy way you presented in the tabular form. No, it was very easy to understand the basics of cancer. Excellent presentation, sir. Now, I request all the delegates. We have only 20 minutes of time. In that period itself, we have to raise the questions. Sir will be busy after the 4:30, so I have to wind up the session by 4:30 exactly. Only 20 minutes for the questionnaires. You can unmute and raise your hand. Okay. Dr. Sudha. Dr. Sudha, you can unmute and ask the question.
Dr. Sudha.
Namaste, sir.
Namaste.
Very good presentation, sir. I had one question regarding early stages, means after menarche. I had 3 to 4 cases of fibroids, sir.
Fibroid.
Fibroids, multiple breast fibroids.
Uterine fibroid.
No, it's a breast fibroids.
Fibroadenoma.
In breast, sir.
Fibroadenoma.
Fibroadenoma, it's early stage of menarche, means 14, 15, 16 years before marriage, sir.
It may be due to hormonal imbalance, ma'am. We have to check it thoroughly, investigated thoroughly. What is the root cause of for fibroadenoma?
What are the examinations, sir? What are the diagnosis we have to suggest for the?
If there is the breast lump, then we have to go for mammography first. And then hormonal levels, LH and FSH, all that. If the hormonal level imbalance, then we have to manage according to and also I think that there is the role of there may be role of the gynecologist, Ayurvedic gynecologist be there, okay, along with the Ayurvedic oncologist, okay. And in hormonal changes or hormonal pathologic are not raised, agar unbalance nahi hai hormone, then we suppose that it is idiopathic, is managed according to those dusha. Yeah, I think that we can manage by using the those dusha kalpana. And I have experience also in my clinic
Yeah,
of the adenoma. Most of the patients in this monarchy, you say that the age is the pitta prapop, pitta,
yeah,
pitta, pitta kal age. If you go the age wise, then it is the kala pitta kal. Okay, and
yes,
then if you manage by giving the pitta kappajanya management, likewise avipattikar churna and all that, and keshar gugul and along keshar gugul and avipattikar churna and all that,
yeah, yeah.
then it can be managed in idiopathic nature.
Uh,
If the hormonal changes are there and imbalance, then the patient should be managed according to.
Okay, sir. Okay. So, Avipattika Churna with Prakurti can be treated along with single drug, sir?
No. You have to manage you have to give the Keshar Google there. Okay.
Keshav Putran.
Yes. Kanchana, even you have to give the Kanchana Chal decoction.
Okay, okay, Chala. Yeah, yeah.
Kanchana Chal decoction for the control the that growth.
So, this doesn't affect the menstrual cycle, sir? This
Huh?
doesn't, there is no interference there, regarding their menstrual cycles or heavy bleeding.
Hey, early if there is the delayed menstrual cycle and all that, you have to involve the Ayurvedic gynecologist also.
Yeah, yeah. Okay, okay. No, Chala and Keshav Gugula doesn't affect their menstrual cycles, sir?
No. I have no experience that the Kachnar Shala and Ayurvedic Churna and Keshar Gugul affect the menstrual cycle.
Okay,
Uh,
sir.
Thank you.
Thank you, sir.
Sir, I have one question.
Uh,
Have you treated retinoblastoma? And what about the problem?
I had patient, ma'am, but blastoma, the blastoma. All the blastoma belonging to the Vatanubandhi. The Vayu Vivardayati. The division, the role of Vata is the division. Okay, and more divisions causes the blastoma. So जहां जहां पे ब्लास्टोमा लगा है वर्ड, जहां पे ग्लायोब्लास्टोमा, रेटिनोब्लास्टोमा, जहां पे ब्लास्टोमा लगा है, दे हैव द वेरी पुअर प्रोग्नोसिस, बहुत पुअर प्रोग्नोसिस होता है और बहुत फास्ट ग्रोथ. ठीक है, आई हैड पेशेंट बट नॉट इम्प्रूव्ड वेल.
Okay, sir.
क्योंकि ये वात जो है, ये वातानुबंधी होते हैं, जहां वात का ज्यादा इन्वॉल्वमेंट हो वो ग्रोथ फास्ट होती है.
Okay. Thank you, sir. Dr. Usha is asking, what is the prognosis of tongue cancer?
लंग कैंसर,
Tongue.
टंग कैंसर. ओके, टंग कैंसर. सी दैट व्हेन अगर हमारे पास पेशेंट आता है, कोई भी हमने एक प्रोटोकॉल बना के रखा है, कोई भी पेशेंट डायग्नोज पेशेंट या अनडायग्नोज पेशेंट अगर समझो आता है या डायग्नोज हम करते हैं, तो फर्स्ट वी सजेस्ट to consult the oncologist, because we are working in our institution level. So we are bonding to institutions law or rule. तो हम oncologist को ओपिनियन लेते हैं. ठीक है, और oncologist अगर समझो अगर पेशेंट फिट नहीं है ऑन्कोलॉजी के लिए, कीमोथेरेपी के लिए, रेडियोथेरेपी के लिए या सर्जरी के लिए फिट नहीं है, बहुत बार ओल्ड एज पेशेंट और वीक पेशेंट नॉट फिट फॉर कीमोथेरेपी और सर्जरी आल्सो, या विलिंग नहीं है पेशेंट विलिंग नहीं है, तो ऐसे में हम स्टैंड अलोन ट्रीटमेंट देते हैं. ठीक है, अभी स्टैंड अलोन ट्रीटमेंट के बारे में कह रहा हूं मैं कि स्टैंड अलोन ट्रीटमेंट्स में वी कैन कंट्रोल द ग्रोथ. we will able to control the growth, but not able to inhibit the growth. हम कंट्रोल कर सकते हैं, लेकिन इनहिबिट करने मतलब मुझे मेरा अभी तक का जो भी है टंग कैंसर का, हम कंट्रोल कर सकते हैं, बहुत दिनों तक कंट्रोल कर सकते हैं, मतलब कितने भी दिनों तक हम कंट्रोल कर सकते हैं, लेकिन वो ग्रोथ जो है वो रिड्यूस नहीं होती है। और कुछ पेशेंट हमारे पास आफ्टर के कन्वेंशनल थेरेपी आते हैं, तो इंटीग्रेटेड मेथड मैं जो सजेस्ट करता हूँ, इंटीग्रेटेड मेथड जो है दैट इज द बेस्ट फॉर ओरल कैंसर और टंग कैंसर।
Okay, sir. Thank you, sir. Dr. Satish Patel is asking, what are medico-legal conditions for cancer?
मेडिकल लीगल प्रॉब्लम्स आर देयर मैम। देखिए, एक तो हम कैंसर, देखो एक तो जो है हम अर्बुद अगर डायग्नोस करते हैं तो अर्बुद के ट्रीटमेंट पे जाना पड़ेगा, ठीक है, और अर्बुद की ट्रीटमेंट्स आर वेरी कॉन्स्ट्रिक्टेड है हमारे इसमें, 4-5 ही ड्रग है, रौद्र रस, अर्बुदर रस एंड अर्बुदर कषाय, कुछ ड्रग्स ही है, एंड ऑन द बेसिस ऑफ दैट ड्रग्स वी कैन नॉट मैनेज द होल पेशेंट, ठीक है, क्योंकि अगर अर्बुद डायग्नोस करते हैं तो हमारी ट्रीटमेंट भी अर्बुद की होनी चाहिए, ठीक है, और हमारे सिम्टम्स जो है वो भी अर्बुद के साथ मैच होने चाहिए जो अर्बुद में वर्णित है कैंसर के, जो हमारे पास पेशेंट आया है। तो जनरली कार्सिनोमा जो है 90% इज कार्सिनोमा, 90 to 95% जो है कार्सिनोमा होता है। कार्सिनोमा के कोई भी सिम्टम अर्बुद के साथ मैच नहीं होते, मैक्सिमम सिम्टम मैच नहीं होते, क्योंकि वो एपिथेलियल सेल की ग्रोथ होती है, द एपिथेलियल सेल, द lining, it is the lining of the mucosa, of lining of the skin, and arbud is the inner in position। अगर समझो स्किन की लेयर देखते हो, अर्बुद का जो स्थान है वो इनर पोजीशन में है, अपर लेयर नहीं है, तो ऐसे में हम अर्बुद को डायग्नोस नहीं कर सकते। इन दैट केस फिर हम क्या डिपेंड हमें डिपेंड रहना पड़ेगा दोष, दृश्य और स्रोतस विकृति। तो ऑन द बेसिस ऑफ दैट हम ये नहीं कर सकते कि हम कैंसर कर रहे हैं, क्यों? क्योंकि वी हैव नो एग्जैक्ट एंटी कैंसर ड्रग, एविडेंस बेस्ड एंटी कैंसर ड्रग्स, एग्जैक्ट एंटी कैंसर एविडेंस बेस्ड एंटी कैंसर ड्रग्स इन मार्केट, ठीक है, बिकॉज अगर हम कहेंगे कि एंटी कैंसर ड्रग, हम ये एंटी कैंसर ड्रग है, तो वी हैव नीड द such type of evidences, lot of evidences, clinical evidences, not a case study, okay, so at that time while the diagnosis we have to हमें ध्यान रखना होगा कि हम दोष, दृश्य, स्रोतों पे ज्यादा ये रखें, और we manage the दोष, दृश्य, स्रोतस, ठीक है, we manage and we treat according to for our safest side। अदरवाइज व्हाट हैपन, अगर समझो हम कैंसर डायग्नोसिस कर रहे हो, इधर आप लिख रहे हो प्रिस्क्रिप्शन पे कैंसर और आप उधर ट्रीटमेंट लिख रहे हो, तो अगर कैंसर ट्रीटमेंट लिख रहे हो तो कैंसर एंटी कैंसर ड्रग आना चाहिए, और एंटी कैंसर ड्रग आपकी किताबों में होना चाहिए, आपकी किताबों में एंटी कैंसर ड्रग नहीं है, और आपका कोई ऐसा ड्रग नहीं है कि जो एविडेंस बेस्ड एंटी कैंसर प्रूव हुआ हो, so we can write anti-cancer drugs if you diagnose the cancer। So what is the solution for that? हमने जो अभी वर्कशॉप कराया तो उसमें ये सॉल्यूशन निकला कि जो अनुक्त व्याधि का जो डायग्नोसिस है, जो विमान स्थान 4 में बताया गया है और सूत्र स्थान में भी बताया गया है कि हमें व्याधि की जरूरत नहीं। देखो, अगर समझो कोर्ट केस होती है, कंज्यूमर फोरम में कोई पेशेंट जाता है, आपके ट्रीटमेंट की वजह से अगर कुछ डैमेज होता है, तो आपको क्या देखा जाएगा? आपके रेफरेंसेस देखा जाए कि आपने कैसे डायग्नोसिस किया और क्या ट्रीटमेंट दी, और आपने जो ट्रीटमेंट दी है उसके रेफरेंसेस क्या है। ये प्रॉब्लम, ये यहाँ से शुरुआत होगी कंज्यूमर फोरम में। अगर समझो ये शुरुआत होगी तो यू हैव टू शो द रेफरेंसेस। अभी रेफरेंसेस आपके एंटी कैंसर के है ही नहीं, ठीक है। अर्बुद के, अगर अर्बुद लिखते हो तो अर्बुद के साथ आपके क्लिनिकल मैनिफेस्टेशन मिलना चाहिए, और ड्रग भी आपको अर्बुदर या अर्बुदर से रिलेटेड ड्रग लिखना पड़ेगा, ठीक है। तो एग्जैक्ट फिर आपको फिर वहां पे आना पड़ेगा, कहाँ पे, आपको अनुक्त व्याधि का जो डायग्नोसिस हमने हमारे आयुर्वेद में हम वहां पे प्रूव करा सकते हैं कोर्ट में या कंज्यूमर फोरम में कि वी हैव अ डायग्नोस्टिक मेथड्स ऑफ अनुक्त व्याधि, ठीक है। और ये अनुक्त व्याधि का मेथड्स है, और उसके अकॉर्डिंग टू हम दोष, दुष्य, स्त्रोतस विकृति, मल विकृति एंड सारी ये करके अकॉर्डिंग टू वी ट्रीट द we manage the patient of cancer, not the cancer. Okay, we treat the patient of cancer. Both have different meaning. To treat the cancer and to manage the patient of cancer, both have different meaning medically. Medically different meaning है दोनों का। अगर समझो मेडिकली डिफरेंट मीनिंग नहीं भी लग रहा हो, लेकिन मेडिकली डिफरेंट मीनिंग है। हम पेशेंट को कर रहे हैं, पेशेंट को मैनेज कर रहे हैं, हम पेशेंट की व्याधि को मैनेज कर रहे हैं, हम कैंसर को मैनेज नहीं कर रहे ऑन द बेसिस ऑफ दोष, दुष्य, स्त्रोतस एंड हम दोषों को, दुष्य को, स्त्रोतसों को और बाकी जो भी व्याधि घटक है और संप्राप्ति घटक है उसको हम मैनेज कर रहे हैं। ये आप वहां पे लीगली मेडिकल कंज्यूमर फोरम में आप ये कर सकते हैं, एंड ये हमारा स्टैंड होगा और इस स्टैंड से आप बच सकते हो।
Okay, sir. Thank you, sir. Dr. Mallikarjun is asking, post-operated tumor can be treated, and it is possible to prevent regrowth of tumor also, sir.
Yes, post-operative we have lot of patients. पोस्ट कुछ पेशेंट ऐसे भी है हमारे पास कि वो कीमोथेरेपी नहीं लिए, कुछ पेशेंट ऐसे भी है कीमोथेरेपी छोड़कर, क्योंकि उनको सीवियर साइड इफेक्ट हुए तो छोड़कर हमारे पास आ गए, बीच में ही आ गए आफ्टर 3 साइकिल और 4 साइकिल, ऐसे भी है। और ये सारे जो पेशेंट है वो अभी तक मेरा अनुभव है वी कैन मैनेज, लेकिन इसमें आपको प्रोग्नोसिस का ध्यान देना होगा। प्रोग्नोसिस का ध्यान क्या देना होगा, कुछ जो कैंसर है फास्ट ग्रो होते हैं, मैंने कहा आपको, जैसे एंडोक्राइनल कैंसर, ब्लास्टोमा, इवन ट्रिपल निगेटिव कैंसर, स्मॉल सेल कैंसर ऑफ स्मॉल सेल कैंसर, ये फास्ट ग्रो होते हैं, इनको आप अश्योर मत करिएगा, है ना। ऐसे तो अश्योर किसी को भी नहीं करना है, लेकिन ये बहुत फास्ट ग्रो होते हैं, मतलब विद इन 3-4, मतलब आपका ऑपरेशन हो गया और ऑपरेशन के बाद 3-4-6 महीने में रिकरेंस होकर आता है पेशेंट, ठीक है। तो यू हैव टू, बिकॉज ये जो ऑन्कोलॉजी ये बहुत वास्ट स्टडी, ठीक है। वहां तो डीएम करते, पीजी मेडिसिन के बाद डीएम करने के बाद वो ऑन्कोलॉजी की प्रैक्टिस कर रहा है। हमारे पास इस प्रकार का कोई एजुकेशन का ये नहीं है, मतलब इंस्टीट्यूशनल एजुकेशन कि हम कोई डीएम कर रहे हैं या एमडी कर रहे हैं, एमडी आइन ऑन्कोलॉजी हो रहे हैं। तो वी हैव टू स्टडी ऑल दिस प्रोग्रेसिव इन ऑल दैट, और अकॉर्डिंग टू वी हैव टू मैनेज द पेशेंट। हम मैनेज कर सकते हैं एक्सेप्ट दिस endocrine and small cell carcinoma and blastoma, all that we can manage other cancers, and we can prevent, we have patients, lot of patients, prevent the recurrence.
Okay, sir. Thank you.
मैंने कुछ उदाहरण दिए, उसमें रिकरेंस जल्दी होता है, ये ध्यान रखिएगा। जैसे मैंने कहा कि ब्लास्टोमा, न्यूरोब्लास्टोमा मल्टीफ्री, स्मॉल सेल कार्सिनोमा ऑफ लंग्स, इवन ट्रिपल नेगेटिव कैंसर ऑफ ब्रेस्ट, यहाँ पे इवन सीरस कार्सिनोमा ऑफ ओवरी, हमारे पास ओवरी का एडेनोकार्सिनोमा ऑफ ओवरी का पेशेंट मैंने इसको पबमेड में पब्लिश भी किया है, ठीक है, मैं शेयर कर लूंगा ग्रुप में। वो 3-4 साल से आफ्टर ऑपरेशन वो हमारे पास आया, पोस्ट ऑपरेटिव आफ्टर रिमूव ऑफ द एडेनोकार्सिनोमा ऑफ ओवरी, वो बिल्कुल नॉर्मल है, कोई रिकरेंस नहीं। मुझे लगता है 4 साल हो गए उसको, 4 या 5 साल, बिल्कुल ग्रोथ नहीं है, CA-125 नॉर्मल है। लेकिन मेरे पास ऐसा भी पेशेंट है सीरस कार्सिनोमा ऑफ ओवरी, जो रिकरेंस बहुत जल्दी होता है उसका, क्योंकि वो बहुत फास्ट ग्रोइंग होता है। ठीक है, तो वो फास्ट ग्रो होने की वजह से उसका रिकरेंस हुआ। तो आपको प्रोग्नोसिस का मतलब प्रोग्नोसिस जो है किस कैंसर में क्या है, इवन अगर ओवरी का, हम क्या है कि ब्लाइंडली जाते हैं कि ओवरी कैंसर, ऑल ओवरी कैंसर, द प्रोग्नोसिस ऑफ ऑल ओवरी कैंसर आर नॉट सेम, है ना। देर आर सेवरल टाइप ऑफ सी ओवरी, adenocarcinoma and serous carcinoma and all that, and according to that prognosis are different. We have to also look that also. लेकिन ओवरऑल अगर समझो कुछ कैंसर अगर छोड़ दो, स्मॉल सेल कार्सिनोमा एंड एंडोक्राइनल कार्सिनोमा, सीरस कार्सिनोमा एंड ऑल दैट, एंड न्यूरोब्लास्टोमा एंड ऑल दैट, अदरवाइज जो है ये 10% है, 10 या 5% कार्सिनोमा है, तो इनको अगर छोड़ दे इवन तो आप बाकी इसमें रिकरेंस आप टाल सकते हो। इवन सार्कोमा, लिपोसार्कोमा, मायोसार्कोमा, इसमें भी अगर पोस्ट ऑपरेटिव के बाद आपका रिकरेंस होता नहीं है अगर समझो विथ।
Sir, some more questions are there. Shall I take or I should wind up?
5 minutes.
Okay, I'll take 2 more questions, then I'll give the vote of thanks. Now I request Dr. Savita, you can unmute and you can raise the question.
Namaste, sir. Sir, is there any common drug that can be safely used in cancer? And one more question is, which kind of Panchakarma therapies can be practiced safely in cancerous patients?
Basti is the most safest in Panchakarma.
Yes, sir.
Basti, we use generally Basti to prevent the recurrence and metastasis and all that. We have to see that Basti indication, contraindication in Basti Adhyay. You know what I am saying, that our syllabus are scattered. You know.
Yes, sir.
वहां देखना होगा बस्ती अध्याय में इंडिकेशन कंट्राइंडिकेशन, अदरवाइज बस्ती इज द सेफेस्ट। आप वहां पे देखिए कि क्या क्या कंट्राइंडिकेशन है, वो छोड़कर आप बस्ती दे सकते हो सेफेस्ट में, ठीक है। हम विरेचन भी देते हैं, बहुत बार विरेचन देते हैं, ठीक है, अगर लेकिन विरेचन हम मेटास्टेसिस में नहीं, जो नॉन मेटास्टेटिक जो पेशेंट होता है
ओके सर,
हाँ उसमें विरेचन भी देते हैं, हम बहुत बार देते हैं विरेचन। और पूर्व कर्म तो शिरोधारा और ये सारी जो चीजें हैं तो वो तो देते ही है, वो तो सेफेस्ट है। हमने एक दो पेशेंट को वमन भी दिया है
ओके सर,
फर्स्ट स्टेज में, लेकिन वमन इज नॉट कॉमन एंड नॉट सेफेस्ट, यू नो। लेकिन मोस्ट सेफेस्ट इज द बस्ती।
ओके सर,
मात्रा बस्ती तो हम मतलब कहीं भी मतलब आराम से देते हैं। और इवन नीरो जो काल बस्ती, योग बस्ती, वो भी बिल्कुल आप मतलब आराम से दे सकते हो। बस वो बस्ती अध्याय में जाकर आपको कोई कॉन्ट्राइंडिकेशन नहीं है वो देखना है।
ओके सर, बस्ती मतलब कॉमनली आपने बताया मुस्ताद यापन बस्ती है,
हाँ
इसके
मतलब
अलावा कोई और बस्ती?
हाँ बहुत सारे देते हैं हम, न्यूरो बस्ती दे, इवन पेशेंट आया, पेशेंट क्या कहते हैं जो कीमोथेरेपी इंड्यूस जो ये होता है ऑस्टियोपोरोसिस,
हाँ सर,
तो वी गिवन द क्षीर बस्ती एज अ न्यूरो।
ओके सर,
क्षीर बस्ती, पंचतिक्त क्षीर बस्ती न्यूरो एंड पंचतिक्त घृत एज अनुवासन। तो मुस्तैदी अपन बस्ती के अलावा भी बहुत सारी बस्तियां देते हैं हम सेफली। और द्रव्य भी हम चेंज करते हैं अकॉर्डिंग टू साइट ऑफ कैंसर एंड अकॉर्डिंग टू दोज दृश्य।
Dr. Rajesh sir.
थैंक यू सर।
हाँ
Dr. Rajesh sir, you can unmute. Dr. Anjali.
नमस्ते सर, मुझे एक केस के बारे में ही पूछना था। एक 35 ईयर ओल्ड मेल पेशेंट, उसे सीए ब्रेन, उसमें मल्टीपल ये सिस्ट जैसे थे और वो उसको रेडियोथेरेपी और कीमोथेरेपी सजेस्ट की गई थी। तो 8 डोजेस जो उन्हें दिए गए हैं, उसने 4 लिए और उसके बाद उसके किडनी का फंक्शन फंक्शन खराब हो गया, मतलब अभी वो पोटेशियम नहीं फिल्टर कर पा रहे हैं, तो वो लोग अकॉर्डिंग टू देयर ट्रीटमेंट दे से कि अगर आपको पोटेशियम कम हो जाता है तो आप पोटेशियम लीजिए और अपने बॉडी का जो फ्लूइड्स हैं वो फिल्टर हो जाते हैं, अदरवाइज पूरी बॉडी सोलन हो जाती है, सो दे हैव स्टॉप द ट्रीटमेंट। तो जो आपने बताया कि बहुत सारे कॉम्प्लिकेशंस भी होते हैं उसके, ऐसे केसेस में हम कुछ हेल्प कर सकते हैं विद आयुर्वेदा।
बिल्कुल मैडम, बिल्कुल। देखिए,
जी
आपको भी देखो, आपने विकार, किडनी का विकार कहा है ना।
जी
हाँ, इन दिस केसेस, अभी देखो, आयुर्वेदा मैटर इज कैटरेटेड, हाँ,
हाँ
एक
जी
जगह पे नहीं है मैटर, एक जगह पे नहीं है। तो
जी
यहाँ पे आपको जो मूत्रगत मूत्राघात में वर्णित
जी
जो बस्ती बस्ती है, हम यहाँ पे
जी
देते हैं बस्ती, है ना।
ओके
ठीक है, मूत्राघात में वर्णित अगर समझो बस्ती देते हैं, काल बस्ती,
जी
योग बस्ती, ये बस्ती, ठीक है।
जी
और कुछ जो ड्रग्स है मूत्र व संस्थान में चलती है,
जी जी
गोसूर, ये जो अगर समझो आप देते हो,
जी
ठीक है, तो हम देते हैं यहाँ पे, इसलिए यहाँ ऐसे पेशेंट भी हमारे पास आते हैं।
जी
तो पेशेंट को जो किडनी फंक्शनिंग, इसमें अगर परमानेंट डैमेज नहीं हो तो देखो, हाँ, इसमें भी
हाँ
आपको परमानेंट अगर डैमेज हो तो यू कैन रिवाइवल,
हाँ
ठीक है।
हाँ
लेकिन अगर समझो टेम्पोररी डैमेज हुआ है, रिवर्सिबल
जी
डैमेज है, तो ये अगर समझो बस्ती देते हैं,
जी
तो और अगर समझो कुछ ओरल ड्रग देते हो आप, ठीक है,
जी
तो ये जो है पेशेंट को हेल्प होगी और पेशेंट रिवाइव हो सकता है।
ओके, थैंक यू।
Dr. Vijaya, last question. Dr. Vijaya. Okay, thank you, sir, for a wonderful presentation.
Dr. Vijayalakshmi ma'am,
ठीक है,
you can unmute yourself.
3 times I called, madam. That's why I'm winding.
Sir, can we take 2 more questions, sir, raised by Ajit sir and Dr. Savita ma'am?
I called, madam, already, Ajit sir also.
Sir, can we take, sir, further
हाँ, take.
5 to 8 minutes, sir?
हाँ, लीजिए लीजिए।
Okay, yeah. Please go ahead with Dr. Vijayalakshmi ma'am. Are you there, ma'am?
नहीं, अभी 3 क्वेश्चन दे दो, फिर मतलब 30 तक हूँ मैं वहाँ पे, अभी उसके बाद में एक मीटिंग है मुझे।
तो हम लोग वाइंड अप करते हैं, सर,
हाँ,
क्योंकि 4:30
क्वेश्चन ले लो, फिर मैं लीव करके चला जाऊंगा।
तो क्वेश्चन, सर, एक काम करते हैं, सर, लेट देम आस्क द क्वेश्चन, वी कैन शेयर दो, सर, आप उसको ग्रुप पे कर सकते हैं ना, सर?
ग्रुप में शेयर करिएगा।
हाँ, sir. Please post your questions in the chat box. We will share that in the group and sir will answer to that same. Sambamurthy sir and Ajit sir and Vijayalakshmi ma'am, please post your questions in the chat box. Yes, Pushkala ma'am. Please.
Namaste, sir.
नमस्ते।
It was a wonderful presentation, sir. Thank you very much for the deep insight, sir. Sir, what about Balatak Yoga that you have mentioned, sir, in the treatment protocol? And, there are lots of controversies while using Balataka, saying that it may cause lots of reactions, especially in Pitta Prakriti people. When we see lots of issues are also with related to Pitta in treatment of cancer. How are we using Balataka Prayoga as well? What is the references, sir? Thank you very much, sir.
Say ma'am, there is always in Ayurveda also indication, contraindication in every time. Okay, it may be Panchakarma, it may be Tikshna drug or Visa Aushadhi. Bhalatak is a Visa Aushadhi. Bhalatak you have where you have to give and where you have to not give. Okay, पित्त प्रकृति के पेशेंट में नहीं देना है. Okay, even we Bhalatak you have the Kapakna in natures. Okay, and पित्तवर्धक इन नेचर्स. तो जहां जहां पित्त का स्थान है वहां पे नहीं देना है. What where it can be used, where the kapasthan will be there, the cancer of kapasthan, like breast again kapasthan, because adipose, lot of adipose tissues and mass are there. Lung, even the sthan is the kapasthan. You can use the bhalatak in kapasthan means the sthan where the kapasthan, and use the drugs kapha pradhan cancers. You should not use the bhalatak in squamous cell carcinoma, because again squamous means what? Epithelial cell. रक्त व्याधि, रक्त धातु इज, तो स्केमस सेल्स कार्सिनोमा में ये काम नहीं करेगा, लेकिन ये काम करेगा एडेनोकार्सिनोमा में। और विहर कहाँ पे ज्यादा काम करेगा? कप स्थान में करेगा। और यू शुड ऑलवेज अवॉइड टू गिव द बलातक इन पित्त प्रकृति पेशेंट, मतलब कप प्रकृति का पेशेंट हो, कप स्थान हो और एडेनोकार्सिनोमा हो, वहां पे बलातक बहुत अच्छा काम करेगा। ठीक है, अगर आप पैनक्रियाज में देते हो तो वहां नहीं काम करेगा। पैनक्रियाज हैविंग द पित्त स्थान, यू नो, मतलब हमारे जो आयुर्वेद के बेसिक है सूत्र स्थान में, वो भी आपको यहाँ पे यूज करने हैं। व्हाट आई एम सेइंग, हमारे जो आयुर्वेद के बेसिक है सूत्र स्थान में, कफ के स्थान, पित्त के स्थान, वात के स्थान, वो भी हमें ट्रीटमेंट करते वक्त यूज करना है। अगर हम गैल ब्लैडर में, अगर हम पैनक्रियाज में यूज करेंगे भला तक, तो इट कैन वर्क, बिकॉज पित्त स्थान है वो। तो कपस्थान, कपस प्रधान कैंसर और कप प्रकृति के पेशेंट में भला तक इज वंडरफुल ड्रग।
Thank you very much, sir.
Okay. May I leave, ma'am?
Now we'll give some vote of thanks, sir.
Okay.
2 minutes, sir. That's it. I request Dr. Veena to say vote of thanks.
Thank you so much, ma'am. Good evening, one and all. On behalf of Rao's team, I am glad to express my sincere vote of thanks. At the first, a wholehearted thanks to our respected guest speaker, Dr. Sharad Pote, sir. In spite of your busy schedule on research and presentation at the national and international levels, sir took time to enlighten us. Thank you so much, sir. Thank you for your explanation on the need of Ayurveda in cancer at the present age. So, scope of Ayurveda in the prevention and management of cancer, the challenges faced by Ayurveda in oncology. Thank you so much, sir, for delivering such an engaging and informative session. Your enthusiasm and in-depth knowledge in the subject was evident throughout the session. Thank you once again, sir. Thank you, Gurukula team, for organizing the event. Thank you, Dr. Kanchana ma'am, for the prayer. Thank you, Dr. Kanchana ma'am, for the introduction of our speaker. Thank you, Dr. Geeta ma'am, for the moderation. A sincere gratitude to our founder ma'am, Dr. Shakuntala J. Patil, for the Rouse platform. The wholehearted thanks to all the participants, the delegates who attended the webinar to make it a grand success. Thank you so much for the support and expect the same in the future. Thank you all once again. Thank you, ma'am.
Thank you, Dr. Veena.
Thank you so much,
Sir, thank you,
sir,
sir.
for your time, and it's a very wonderful presentation, sir.
I will share my case studies on group.
सर प्लीज
Thank
सर,
you.
क्योंकि आपने जैसा एक कोरिलेट किया ना, बहुत अद्भुत था सर वो। सो रियली इट इज जस्ट अनमैचेबल, क्योंकि हम लोग ऐसा ढूंढ रहे थे, तो आज तो बहुत ही बढ़िया मिल गया मुझे लग रहा है सर। प्लीज पोस्ट एंड कीप एक्टिविंग और ग्रुप सर प्लीज, क्योंकि मुझे पता है आप बहुत बिजी है। एंड आई एम वेरी हैप्पी टू से दैट शरद पोटे सर इज अवर मेंबर। इट्स
Thank you, ma'am. Thank you. Thank you, ma'am. May I leave, ma'am, because I have one meeting.
Yes, sir. Yes, sir. Thank you so much, sir, once again.
Thank you.
and I request other to leave the webinar except Ross member for 5 minutes last to take a one photo. That's all. Please unmute
Come
your
on to the video.
video. Please come to the video. Ross member, please, to take one screenshot. That's all. It's really very different approach, and it's a very in-depth thing today. Sir taught us. Hemlata ma'am, please. Kimaya.
Madam, can we get recordings, madam?
Yes, ma'am, sure. Within short period. Yeah, we
Okay,
will
thank
get
you,
it.
madam.
Yeah.
Thank you, thank you.
Ajit sir, please come on video. Please come on video, sir. Hello, sir. Why you are not asked, sir? Namaste, sir. Yes, others. Sir, Sambamurthy, sir. Sugama Shetty, sir. Yeah, Pankaj, Daya, Shubha. I think our Ross member are left so many because very few are here. Yeah, Geeta, you can take screenshot. I don't know how to take it from laptop. Yes, Meena, please, you can take screenshot. Very few of us are here. Vishwanath Dixit sir here, left, sir. Tagondra Veena? Okay. Thank you, Geeta, Veena. Bye-bye. Thank you.
Thank you,
Ajit.
ma'am.
Bye.
This one bifurcation was so good, ma'am. Sarcoma,
Yes,
glioma,
yeah.
and he clearly mentioned that.
ಅಲ್ಲ ಅದನ್ನ ಕೋರಿಲೇಟ್ ಮಾಡಿ ಹೇಳಿದ್ರಲ್ಲ.
Ma'am,
So
stop
how-
the recording, no?
Oh, correct. I think we can wind up. Yeah, bye.
ಸ್ವಲ್ಪ ಡಿಸ್ಟರ್ಬೆನ್ಸ್ ಇತ್ತಲ್ವಾ ಮೇಡಮ್?
ನಿಂದು ಲಾಸ್ಟ್ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಇತ್ತು.
ನಂದೇ ಇದ್ರಲ್ಲಿ ಇತ್ತಾ?
ನಿಂದೆ ಇದ್ರಲ್ಲಿ ಇತ್ತು.
ಸೆಂಟ್ರಲ್ಲಿ ಅದು ಇದೇನೆ ಇತ್ತು.
ಮ್ಯಾಮ್, ಸ್ಟಿಲ್ ಇಟ್ ಇಸ್
ರೆಕಾರ್ಡಿಂಗ್ ಇದೆ.